Hey everyone, great news. The governor says the dentist can go back to work. That'll be great news for our patients. I now have a legal pad with patients' names on both sides that have had problems that are so anxious to get back in. So I just want to come to you today and give you a little bit of information about some differences that you will see when you come back to the office now that we'll be able to open again. These are all from the guidelines from the Ohio Dental Association, the American Dental Association, and the Ohio State Dental Board. So one of the things that you'll notice it'll be a little different is you'll be able to wait in your car instead of in our reception area. And when your appointment time is near, my office manager will give you a call. You can come right on into the office and the clinician will be waiting for you to take you right back to your operatory for your treatment. Another little difference is at each visit, every contact that we have, we've been given a questionnaire. It has 9 simple questions on it about your health. It's just a screening. We'll ask you those questions. We'll also take your temperature with one of these little no-touch forehead temperatures to make sure you don't have a temperature. Oh, and by the way, we'll do this to ourselves and do the screening ourselves every time we come to work in the morning. We'll also, you'll notice there'll be some different type of equipment. You'll see the N95 masks or a KN95 mask. We'll be using face shields, some gowns. Yeah, the main thing really that's keeping us from opening right away is just sourcing in the equipment. There's been a real shortage of it. And the governor's been great. I heard him make an announcement that they're going to try to do something with the supply chain to get more of that equipment into the dental offices. So that's good. But the soonest we can probably open up really would be maybe the 6th, 7th of next week. Practically, it'll probably be more like the 11th. It just depends on when all the equipment comes in. So we're excited about that. We're excited to help our patients out. We know that some of you may have some questions. I want you to feel free to call our office. And one thing that I did want to get across, if you're in an at-risk group, or if you're just nervous about coming in so soon after being cooped up in the house and hearing all these warnings on the news, please, if you're in that group or you just feel nervous, just call the office. We'll push out your dental appointment until a time that you just feel better about it. I don't want you to feel any anxiety about that. We'll make sure we do whatever we need to do to make you feel comfortable. Now, the other thing that I wanted to mention, and here's my announcement, my big announcement. This goes for really anybody, whether you're a patient of ours or you know somebody who's not a patient of ours. If you have a question about whether a condition that you're dealing with is serious enough that it's worth leaving your home to be seen at the dentist, I want you to call our office. I will be glad to speak with you and give you some professional advice. We just want to be helpful and give you an idea whether, that is something that probably should be seen, or maybe it's something that could be put off into the future. But I'd be glad to help you with make those decisions. So if you'll pass that word around. One thing I do want you to be confident about, the American Dental Association had a meeting. It was for all the dentists in Ohio. Everybody I know attended. Wherever you go, whoever your dentist is, I want you to know and feel confident that they all will have been given the same guidelines. They'll all have the same equipment to keep you safe, keep their team safe. So I don't want you to feel any anxiety about that. So please call us if you have any questions. Other than that, hey, we're anxious to get you back in, give you that same great care that you've always been getting from us. If you have any questions, please reach out to the office. And thank you so much. We'll see you soon.